Hello, I'm visiting with Dr. Hajal at the Sleep Center. Let's talk about children, Dr. Hajal. What kind of problems do they have for sleep?
It all depends. Children can have many problems of sleep.
They can.
Some are part of the normal growing up process. And other would be signs of disease. Like for instance, sleepwalking and sleep talking in children is very, very common.
Is it?
And you have, before the puberty age, you have many children who would wander around the house. And those are frequently very benign episodes, but sometimes they could manifest also, it could be a manifestation of seizures, and that's why it is important to get a sleep evaluation for the child. In addition, you can have sleeplessness, which is the child form of insomnia, and you can also have a lot of sleep apnea issues in children as well. Part of the childhood, you have the adenoids and the tonsils that are big, and then they start snoring. And I frequently say this, that children shouldn't be snorers. They should not snore at all. And when you have a child that is snoring, you should be careful about what is causing that and what could be done about it. Frequently it may affect their functioning during the daytime and even their grades at school.
What about newborns? Should they be on a sleep schedule?
Newborns should, I mean, of course, when they are born, for the first few days, they don't have a sleep schedule whatsoever. It's mainly the feeding schedule that times their cycle. But then they end up adjusting, knowing the day and the night, and then they start following this cycle. And of course, any mom would want them to do that earlier than later. But when they do this, of course, they follow a certain schedule, and then the napping would start getting less and less and less. And frequently, at age 4 or 5, they lose the nap during the day, during the daytime all the way, and they end up just sleeping at night.
Really? So children don't need naps in the afternoon?
I think after the age of 5, they don't really need it. They can get it if they want to, but they don't really need it. I mean, those are children that we're getting them ready to go to school and stuff like that. They should be able to handle the whole day of schooling without having to take a nap.
Okay, a lot of 5-year-olds be happy to hear that. You know?
Yes. The difficulty is sometimes the parents have high expectations about how the child, frequently with the first child, that they would ask us, I mean, the child is waking up now at 4 o'clock in the morning, what am I going to do? And well, the child maybe doesn't need as much sleep because they change so fast that you don't notice that. But 6 months ago, they maybe were going to bed at 9 p.m., waking up at 7 o'clock in the morning. And now they go to bed at 9 p.m., wake up at 4, but maybe they don't really need that much sleep. They're unfortunately getting a little bit older.
Okay. Well, on a more serious note, what about SIDS? Is that a sleep disorder?
SIDS is almost like the most difficult disease to work with. We are not really sure that SIDS is actually a sleep disorder. It was felt to be for the longest time because those children would actually unfortunately pass away during their sleep.
Right.
But it could be so many other things. It could be genetic, it could be social factors playing a part, and it could be sometimes choking episodes and breathing problems. We're not really so sure what causes SIDS. What we do know is when children sleep on their back, SIDS gets so much less, and you cannot really basically have any unexplained infant deaths after the age of 1 year. Those are very, very young children that are being studied. And as far as I can tell, there hasn't been any research to prove that this is the reason, and this is why it is very important to save those kids when they are so young.
So it's not a sleep disorder?
I can say it is a sleep disorder.
Okay.
We can't even say for sure if it's a breathing disorder as of yet. So it's still, the jury is out on SIDS.
But position matters.
Absolutely.
Them on their back.
That was the only thing that made so much difference, is that with the children sleeping on the back, SIDS really got so much less frequent.
Thank you very much.
Thank you.